3 things you're doing that cause your bruxism and you didn't even know it. We're the Baena siblings, Anna Paula and Federico, a dentist and a physical therapist, and today we're going to explain 3 things you're doing at home that cause you to clench your teeth at night. And this is totally preventable, so get ready. Number 1, using your cell phone. Anna Paula explained to us why when you use your cell phone and you're doing this all the time, you're causing your own bruxism.
The most important thing is to realize that the head is the heaviest part of our body. So when we have a head tilt and we're maintaining that posture for a long time, because let's face it, we don't use it for just 3 or 4 minutes, we spend many hours with the tilt. We create a super strong tension in the anterior and posterior muscles of the neck. If you look at this posture, when you're here, you're shortening the anterior muscles and you're creating a lot of tension in your posterior muscles. So we have a very important muscle here, which is the sternocleidomastoid. When you have it shortened for a long time, there comes a point where it pulls on all the musculature, both mandibular and neck, and you create a brutal tension in your jaw.
And the problem here is that if you look at the anatomy, when you're looking down, the suboccipital muscles are stretched. They're pulling. They're the only ones pulling. And what happens is that after you finish using the cell phone and you kind of stretch, it hurts here. But at night, that tension makes your muscles start to clench too much, and that can cause bruxism. Besides, we're talking about being for a long time with your eyes fixed on the same spot. It's the same as if you were for several hours with your muscles tense like this. It would reach a point where they get tired. And if you don't take breaks, that pressure from the eye muscles plus the neck muscle creates tension in the whole head. Therefore, at night, it makes your muscles start to clench your teeth. It's a reaction that we've seen quite a bit. Now, what should we do then? Because we're not going to stop using the cell phone. Many people even work with it. What exercises can you suggest so that if they were like this for a long time, they can improve?
Okay, the first thing to do is that we have to be aware of the amount of time we spend on the phone. So the first thing is to set an alarm and create a break. Create a break every 10 minutes, stop, put the phone down. Now I'll explain a bit about the posture to take, but stop, rest, do some rotations, especially rotations, extension and flexion of the neck, and take active breaks during all the time we're on the phone. Number 2, it's important to create a work environment where we ensure that the phone is placed a little higher up. You understand me? Instead of having a neck tilt, what we're going to do is rotate the head forward a bit to be a little more upright. How can this be achieved? Well, there are these large cushions we can use to keep our hands relaxed here and our head relaxed. A relaxed head that's more upright instead of being flexed forward. So that's also a great tip for people who work a lot. Let's try to have good posture when we're sitting, with our feet placed flat on the floor. Knees at 90 degrees. We're going to show an image here so you can see roughly what the perfect posture is for spending several hours on the phone.
If you had to hold a bowling ball, how would you hold it? At 90 degrees? Like this or like this? If you want to hold it like this, you won't last very long and you'll get tired. If you hold it like this, it's much better. Why? Because the force is distributed at 90 degrees and there's much more resistance in this lever. It's the same with the neck. If you keep your neck upright for many hours, you can support your head. However, just by tilting it about 20 or 30 degrees, it weighs much more because of the lever it's forming. So you should always try to keep your head like this. Now, if you do this, we're already winning, but there are 2 other things you're doing at home that can cause you to grind your teeth at night. Number 2, how you breathe. This really is a marvel, and at the same time, a nightmare. If you don't breathe well through your nose and you're having those famous apneas, that is, you're snoring and suddenly you stop breathing and then that apnea kicks in, this is highly related to bruxism. Why? Because there are many muscles programmed to open the mouth when you're literally suffocating, but at the same time, those muscles pull the jaw down and then create tension that later leads to clenching. And that's one of the main causes of bruxism. In fact, among our patients, the vast majority of patients who have apneas have bruxism and vice versa. They're closely linked. Now, what can we do about that? Well, there are many things, and the most important thing is to first detect where the problem is. For snoring, there are basically two very important problems. The first is physical obstruction due to a thickening of the posterior airway, and it mostly happens with patients who are obese or have a very large neck. Therefore, when they lie down, gravity itself causes the tongue and all the tissues to collapse and block the airway. That's one. But why are there thin people who snore? And that's very, very common. Many times we look to correct the position of the jaw in patients who snore, and we do that protrusion. There are even devices that protrude your jaw to breathe better during the night, and they still snore, and they're thin. So what's the problem? Well, the problem is in the upper airway, or the nose. If the patient has inflamed turbinates, has sinusitis, has a deviated septum, and doesn't breathe well through the nose, they have no choice but to open their mouth to breathe, and that also causes bruxism. Therefore, a thorough checkup with an ENT specialist. They'll check the permeability of the upper airway to see if air is actually flowing through properly, and if your nose is fine and air flows well, then we need to rule out other things like allergies, because some patients have allergies and their turbinates get inflamed, blocking the airway, so they have no choice but to open their mouth. Because opening your mouth is a temporary fix, but it shouldn't be the way we breathe all the time.
And how many times, Dr. Federico, have you heard people come in and say, I only snore when I'm tired?
Or when they have a few drinks?
Or when they have a few drinks. The reality is that muscle tension in the jaw, as well as the neck, and even the upper shoulder muscles, creates so much tension in the jaw that when we're lying flat, it causes the jaw to open up, and then we start snoring. And it becomes a bit of a vicious cycle where we don't know if it's due to muscle tension or poor breathing. So the most important thing is to get a correct diagnosis. And it's also important to see a physical therapist to understand our anatomy, our sleep hygiene, and our breathing hygiene, which is also very important because we also have to learn how to breathe.
And the third cause that you might not know about, but could be causing your snoring and your bruxism, is toothpaste. Did you know that? There are many toothpastes, practically most of them, that contain a component called sodium lauryl sulfate. What this component does is it's a foaming agent that helps the mouth feel fresh, that sensation that you're actually cleaning it. The problem is that some people are sensitive or react to sodium lauryl sulfate, which inflames their airway. So you brush your teeth, and some dentists even tell you not to rinse your mouth so the fluoride can work, and that's fine, it's correct. But you're also leaving sodium lauryl sulfate in your mouth, and this foaming agent inflames your airway, which narrows the space, causes more mucus, and therefore generates
Snoring.
Exactly. It makes you snore. And not just snoring, it also causes apnea because you're choking on your own thick saliva at night. So if you notice that at night you're having that scratchy throat feeling, like something is blocking your throat, it's likely your toothpaste. And what should be done? Look for one that doesn't have sodium lauryl sulfate.